CMS is proposing a change that could stop Medicare from paying for remote patient monitoring when the people managing it work for an outside company instead of the doctor's office. Wild. So stay with me, because every week I break down the headlines that are moving our industry, and then I bring you a quick summary right here that is always just so good. So buckle up for story number one. We're going to start with hospital prices, because we've all had clients who wanted to know what something was going to cost before they agreed to a procedure, and getting a straight answer was harder than it should have been. So on July 22nd, the Senate Help Committee advanced the Patients Deserve Price Tags Act in a near unanimous vote. A similar bill had actually moved through a House committee one day earlier, but this one, the Senate bill, would require hospitals to post their actual prices in dollars and cents for every single service. And it would also require them to give patients an itemized bill within 30 days, and even insurers would have to publish the rates that they've negotiated with providers. Now, there's another piece that actually caught my attention. If an insurance company's cost estimator tool gives someone the wrong information, the patient could not be held responsible for that mistake. I think that's wonderful. Now, this is still in committee, so nothing has changed for our clients yet. In fact, the American Hospital Association is already pushing back on the 30-day billing rule, because sometimes the insurance company hasn't finished processing the claim by then. Now, for us, this connects directly to conversations that we're probably already having with our clients who are trying to compare hospital costs, confirm their network, or understand what they might owe before a procedure. And we're going to now move to story number two. Wild one. The FBI captured a man accused for helping run a $547 million Medicare genetic testing scheme. According to the Department of Justice, Khalid Ahmed Satari was captured in the Middle East on July 20th and transferred into United States custody. He had a fake Mexican passport, of all countries, my country, and had been on the run after missing a court hearing in December of 2022. Prosecutors say that laboratories connected to Satari billed Medicare more than $547 million for cancer genetic tests that, guess what, were not medically necessary. They say that the operation used recruiters, call centers, telemedicine companies to get Medicare information and order the test. Now, this is now the third person captured in 5 weeks through the FBI's Most Wanted Fraudsters initiative. Of course, there's no enrollment change connected to this story. I just thought it was super interesting and cool. And the charges still have to be proven in court. What it gives you is a timely reason to bring genetic testing scams back into our client conversations. When somebody calls offering a free cancer test or asking for a Medicare number for a free test to our clients, we need to tell them that they need to slow down and check with you and their doctor before they agree to anything. Story number three now. We're going to go back to the remote monitoring proposal that I mentioned at the beginning, because this one could actually affect services that clients are already using. So on July 14, CMS released the proposed 2027 physician fee schedule. We talked about that last week briefly. And one part of the entire proposal would require remote patient monitoring and remote therapeutic monitoring to be handled by clinical staff who work directly for the practice billing Medicare. Now, Medicare has been paying for remote monitoring since 2018, but by 2024, spending had grown to more than $500 million as outside companies became a much bigger part of the business. Now, CMS says that some of these arrangements don't give the doctor's office enough oversight or involvement, which I don't necessarily disagree. And the proposal would also lower certain monitoring payments and require a separate visit before the monitoring begins. Think about the clients using a connected blood pressure cuff or a glucose monitor, or even a scale that sends the information to a monitoring company. Because if that company isn't employed by the doctor's practice, the way that service gets paid for could change on January 1st, 2027. So this could also reach Medicare Advantage plans that use outside monitoring companies as part of a supplemental benefit. Now, nothing changes like today, and CMS is taking comments through September 14th. But as you start looking at 2027 benefits, I think that we need to confirm how the carrier plans to handle these services before we can tell a client that their monitoring program will continue next year. And my friend, this is your update for this week. For the full breakdown, just visit my newsletter on Substack. It's so good and it's free. I know you're gonna love it. And if this helped you stay informed, share it with another agent who also needs to know what the heck is happening, and I will see you next week.